great pleasure for me to introduce Dr. Jonathan Patz for this morning's cardiology rounds. Some of you may wonder, why would we discuss the topic of climate change at cardiology rounds? But hopefully during the course of his presentation, you'll learn why and the links between climate change and air pollution, amongst other things, as exposures to our health and how they are related directly to some of the diseases of our patients. And I'll tell you a little bit about Dr. Patz. He is a medical doctor, has his Master's of Public Health, and leads the Global Environmental Health Institute at the University of Wisconsin. And last evening, he accepted the award for the Chanchlani Global Health Award that we give out annually, and gave an incredible presentation at McMaster. And Dr. Patz, amongst many things that he has done, was one of the lead authors of the United Nations Intergovernmental Panel on Climate Change, which shares the 2007 Nobel Prize with former Vice President of the United States, Al Gore. Dr. Patz has written over 100 peer-reviewed articles, a number of textbooks. He has a massive open online course with respect to climate change and policy. And in 2019, he was elected to the National Academy of Medicine in the United States, which is a huge honor. Dr. Patz has said that scientists owe it to the public to communicate the results back to society effectively. I think that's very important for us to think about. We produce a lot of research, but the communication and the messaging of that research in terms of pushing people to change behavior, pushing policymakers to act is crucial, and many of us are not well trained at doing that. So it's a great pleasure today to have Dr. Patz join us and share with us the importance of climate change as related to health. Dr. Patz.
Sonia, thank you very much. It's been an honor to be here, and I'm glad you could make it this morning and take a look at how climate change may be affecting chronic disease. But the more I'm going to talk about is the actions that we do to combat climate change offer huge benefits for chronic diseases. I'm going to show just a couple of slides that I showed last night for any of you that were in the audience. Just a reminder that climate change, it's really happening. This is actual measured temperatures in the northern hemisphere over time. This is summer temperatures, and that's from 1951 to 1980, 83 to 93, 94 to 2004. Notice the red, the very hot extremely hot temperatures that are fatal in many cases. And then this is the latest that we have. So it really is warming up. And what I talked about last night is, why do we worry about warming? When you think about the physical attributes of climate change, it's rising temperatures, rising sea level because of thermal expansion of salt water when it warms up, but also land-based glaciers sliding into the ocean. And the last one, hydrologic extremes of the water cycle, more droughts, floods, and fires. So that's what climate change brings us. And the question is, well, so what does it mean for health? All of those climatic factors can cut across multiple exposure pathways to affect our health. And each one of these pathways has health outcomes that we're worried about. In a heat wave, we know there's mortality and morbidity in heat waves, and the urban heat island effect, a heat wave over a sprawling city with lots of black asphalt and concrete buildings that retain the heat. That's a problem. Air pollution and aeroallergens. I talked last night about how stagnant air masses during heat waves can intensify air pollution. Ozone, ground level ozone smog is temperature dependent. It's a secondary pollutant that forms from combining volatile organic compounds, VOCs, and nitrogen oxides combines with sunlight and temperature to give that brown haze, photochemical smog. So ozone in particular is very climate sensitive. Aeroallergens, ragweed plants that are exposed to higher temperatures and higher CO2 in the air produce more pollen. And we've seen studies, we were part of a national study that documented increasing ragweed pollen season across the country, especially at higher latitudes and parts of Canada. Ragweed pollen season is 3 weeks longer than it was in the 1950s. So anyone with asthma, that's a problem. I talked last night about infectious diseases, especially those carried by insects or rodents, vector-borne diseases. Insects are cold-blooded, so a small amount of temperature change can have a huge influence on transmission dynamics, especially mosquito-borne diseases. I showed illustrations of the Zika virus and temperature after the record-breaking El Nino event of 2015. I'm not going to talk about that because this is about chronic disease in this morning. Waterborne diseases, heavier rainfall event, hot air holds more water, so when it rains, it can really rain hard. You get these combined sewage overflow events that contaminate surface water. And of course, our health depends on water resources and food supplies, and there are problems with crops. Lots of the studies from the United Nations show that we're going to see a high increase in the number of people at risk because of extreme climate events on food supply. And finally, a lot of these disasters lead to mental health problems, post-traumatic stress syndrome, and even now with the increased repetition of extreme events like flooded basements, things like that, that's very stressful. And psychologists are talking about climate change causing pre-traumatic stress as people are worried about the next storm. So that's a big problem. But I think the biggest problem on the bottom, environmental refugees, forced displacement from extremes in climate that put stresses on natural resources, and farmers are forced to leave their farms and come into cities. I showed an example last night about the Syrian civil war was preceded by the worst drought in the instrumental record, and that may have contributed to the Syrian civil war and all the killing and the refugees. Very hard to prove, but very strong correlations. Anyway, that's a summary. This is a summary slide of, well, why is climate change a health issue? And I talked about a lot of these last night. But today I want to talk about the flip side of this, which is that, you know, climate change affects our health through all of these pathways, but climate change affects every sector. And across the board, it's a huge challenge. And scientists from all over the world and across every discipline have come together to study this problem. And in the Paris Agreement in 2015, it was the heads of states from around the world came together. 147 heads of state came to negotiate action on climate change in 2015. And out of that meeting, you know, the impact scientists have been saying, you've got to stay below 2 degrees centigrade warming compared to pre-industrial levels. Stay below 2 degrees centigrade, because above 2 degrees centigrade, ecosystems fall apart. There's a lot of damage. And the impact scientists are saying, above 2 degrees centigrade average, it gets really dangerous. And so the leaders over the world at the Paris meeting, they asked the United Nations scientists to, well, the UN Intergovernmental Panel on Climate Change, it's scientists, it's not just UN scientists. In fact, it's hardly any UN scientists, it's mostly everyone working under this UN framework. They asked the scientists to determine what would it take in changing our fossil fuel emissions and emitting greenhouse gases, what would it take to actually stabilize the planet below 2 degrees, and if possible, And out of the Paris Agreement, people were talking about we should try to stay below 1.5 degrees warming. So this report came out, global warming of 1.5 centigrade. That report came out, and it showed what would it take as far as actions to reduce greenhouse gas emissions. Here was the answer. And you probably saw last year, you probably saw the headlines. That we would have to cut emissions almost in half, 45% by the year 2030, 10 years from now. In 10 years, we have to cut our emissions by 45% and be carbon neutral by 2050. That's, that was the wake-up call that people said, oh my God, this is happening so fast. This is really, it's upon us. We have to do something really quickly. But from the health perspective, I view this challenge as a giveaway. It's free and might even be a net gain if you look at the actions to be taken, like to stop climate change, and how those actions affect our health, especially chronic diseases. And so in my recent publications, I talk about climate change challenges and opportunities for global health. Solving the global climate crisis, could it be the greatest health opportunity of our times? So there are three big sectors that have a relationship to emissions that are warming up the planet and are affecting our health. The first one is the energy sector. And many of you who are working on air pollution know that if you combine exposure from indoor air pollution and ambient outdoor urban pollution, we're talking about 7 million people that die prematurely every year. In this crowd, you've heard this statistic, the global burden of disease on WHO. A lot of people die from air pollution. Another big sector is the food sector. Agriculture contributes a lot to greenhouse gas emissions, and the way we consume food is not necessarily environmentally friendly, especially with a high red meat and high dairy intake is it's not great for the environment, and in many ways it's not great for our cardiovascular system. And the last one is transportation. And the more we rely on private motorized vehicles, the less opportunity there is for regular physical activity. Now, of course, some of you are athletes, like Sonia is a former cross-country ski racer, and we all get exercise in that way. But if you think about mass populations that can't afford the time or the money to have recreational exercise, it's a missed opportunity when you design cities mostly for automobiles and don't design for walking and biking. Now, of course, when we think about these issues, we really need to go back to the Ottawa Charter. WHO came out with this Ottawa Charter for Health Promotion in 1986. And you can just read it right there. I'll read it. The prerequisites and prospects for health cannot be ensured by the health sector alone. More importantly, health promotion demands coordinated action by all concerned. And I'll just go down to the bottom one. This health in all policies approach, recognizing that we really need to work across sectors. And by working across sectors, we can benefit public health and in so doing, achieve shared societal goals across sectors. So if you're talking to an urban planner that's trying to design for efficient transportation, there should be a health person in the room to say, well, you can have effective transportation and plan for alternative transportation that promotes physical activity. That's a win-win. So I firmly really embrace this health in all policies approach as we look at any of these things. So I'm just seeing people, you know, there is someone can sit in that chair right there where my jacket is. Okay. Let me give you some examples of this idea of health in all policies. The Summer Olympics came to Atlanta, Georgia in 1996. And Atlanta, Georgia has a lot of traffic. And the mayor there was saying, we've got to do something for the athletes. We want to reduce air pollution. So we had this natural experiment. They did traffic policies where they cut traffic, and traffic fell by 23% right before the Olympics, you know, intentionally just for the Olympics. Well, of course, no surprise, cut the traffic. Air pollution fell. Peak ozone levels fell by 28%. And no surprise, we saw asthma-related emergency room visits by children falling by 42%. And of course, because I know some of you are epidemiologists, you would immediately ask the question about confounding factors. And yeah, well, less traffic, less people driving to the ER, it's confounding this. But, you know, children's ER visits for non-asthma did not change either. So, you know, it's a good controlled epidemiologic study. So we know this, it's not rocket science. Cut traffic, air pollution changes, and we see a health benefit. This happened after the Beijing Olympics as well. I don't have the health data, but I have the air quality data just showing that the interventions that the Chinese did before their Olympics, you know, you can see all these different pollutants dropping dramatically as far as that result. Now, as far as how we generate energy, in the United States, we still generate energy, a lot of energy from coal, burning coal. And I want to show you a map of pollution from coal-fired power plants and the risk of mortality. You can see, depending on where you live, and I think that unfortunately here near, you know, in Ontario, you're suffering from some of U.S. pollution. I apologize. It's not good. But, you know, so we know that, you know, burning coal is not a good idea anymore. It hasn't been a good idea for a long time, and especially now. And I'm going to show you some results from new data that talks about alternatives to fossil fuels that are even cheaper than fossil fuels. And it's a shock and surprise to the economists and the investors to say, coal, that's the stupidest investment I've ever heard of right now, when renewable energies are really cheap. I'm going to talk a little bit about transportation and physical fitness, but first let me show you this study, a new study out last year by Susan Annenberg, looking at the pollution from transportation. And this is looking at fine particles, PM2.5 on the top, and ozone. And these are transportation-related pollution, showing parts of the world that are benefiting from environmental policies and clean transportation policies. But other parts of the world, there's still an increase in motor vehicle usage and the environmental policies are lagging. China is a sort of a mixed picture where this is from 2010 to 2015 changes over those 5 years. But China in the last 5 years is really ramping up their environmental policies. I've heard that, you know, China, if you've been to Beijing, you land at the airport and you can't see the sun on a sunny day. That's changing. And China is cleaning their air pollution multiple times faster than the United States cleaned up our pollution after the Clean Air Act. So China has been terrible. but they are rapidly making progress on their air pollution. But this is this 5-year period, 2010 to 2015. Notice parts of the world are lagging in air quality related to transportation pollution. So we have some options to either keep burning fossil fuel or try to get to cleaner energy technology. This is a study from about 7 years ago that asked the question, what would the investment cost be to not emit 1 ton of carbon dioxide? So let's say we invest in solar or wind, and whatever we do, cleaner energy, the investment, it might be $30 to avoid emitting 1 ton of CO2. But when you burn coal and oil, what else do you emit besides greenhouse gases? You emit hazardous pollutants like PM2.5, nitrogen dioxide, sulfur dioxide, heavy metals, things like that. So if you were to just ask this question, let's just look at PM2.5, which we know has a big impact on mortality around the world. For every ton of CO2 avoided, how much PM2.5 would not be emitted as well? And what's the economic value there? So for every ton of CO2 avoided, the reduction in PM2.5 pollution is such that the average health benefit from avoided mortality and morbidity is about $200. And I asked the decision makers, tough question, which number is bigger, 30 or 200? Because, and I've done this before, and the policymakers said, well, we were only thinking about the investment costs. We didn't even think about, cleaner air and what it'd be for health. We just think about, we don't want to pay more money for energy because coal is cheap. But when you look at the benefit to get off of dirty energy sources, it far outweighs the investment costs. And if you look at places like India and other places that have very bad pollution, this health benefit is much higher, 10 to 70 times greater. So look at that $30, a policymaker will still say, well, I don't want to pay any more money. Well, the $30 is now in question because the price of renewable energy is just plummeting. Look at the price of solar since the 1970s. It's dropped 99%. And even in the last 7 years, solar and wind have dropped 80 and 30% respectively. So the price of renewables is really falling. There's been this question about jobs, the loss of fossil fuel jobs. This is from the US Energy and Employment Report from 2017, showing 1 million jobs in renewable energy, which is 5 times more jobs than in coal, oil, and gas combined. So, of course, jobs and income, that's health. And there are countries around the world that are taking advantage of this. Look at China as far as renewable energy jobs. They're really investing big time. Jobs all over the world. I don't think I have Canada statistics here, sorry. Just for the southern province, the United States. But so this is a golden opportunity. The other thing, this is IRENA, the International Renewable Energy Agency. And they came out with a report last year, which was shocking. I alluded to it earlier, that if you want to build a power plant and generate electricity and forget about the environment, forget about subsidies, just what's the cheapest way to build a plant and generate electricity? For the first time ever, renewable energy beats any kind of fossil fuel, natural gas, coal, whatever, as far as costs, investment costs. So there's no sacrifice. There's no, we're not waiting for a solution. There's no excuse, especially from a health perspective, to demand of your government and decision makers to demand clean energy. And the jobs argument is a false argument. Hello. Somebody's growling at me. There's
no smoke coming out,
okay,
so that's good.
That's good. That's interesting. Oh, that's trying to keep me awake. Yeah. What is that? Maybe that's
It's a fan inside the computer.
Oh, wow.
Yeah, it's a fan.
Cool. All right.
Okay, so let me just put it again.
Well, you guys can't. Can you guys hear that, or it's just me? Oh, you can hear it too. Okay.
It's there. You can hear it, but
Okay. That's, all right. Just make sure you're awake. You guys all awake? It gets louder. Okay. So, well, you know, when I talk about climate change, things heat up, you know, so that's why. Okay, so another sector is the food sector. And if you can see that in the back, you know, I am full of greenhouse gas. Do you have a stake in it? It's all about, you know, high meat diet is very hard for the environment. And in many cases, you guys know this in cardiology, you know, the issue of, you know, high meat diet is not great for our cardiovascular system. Agriculture sector contributes a lot to the problem of climate change. And, you know, agriculture, especially livestock in developed countries is significant, even to oil and gas companies. Now, I am not for vegetarian diet worldwide. Livestock in developing countries is really important for micronutrients. Livestock are like a financial bank for poorer families. So this is mostly for over-consuming countries that really are big into meat and dairy. It's a problem, but it's not, I don't say this is something we should do universally. This is something most all of you would be aware of. On the y-axis, the environmental costs of our diets. This is looking at CO2 equivalents, so the amount of stress on the environment, comparing a meat-based diet in the left versus a low meat and fish and vegetarian and vegan diet. You can see eating lower on the food chain, it's better for the environment. And here's a comparison looking at red meat versus pork versus chicken and insects, alternative protein through insects. But you could substitute the insects for simply plant-based diet. Also, you don't have to eat insects, although I have a postdoc who's studying edible insects. But look at the feed, the amount of feed and the amount of water and the amount of land use to raise a kilogram of protein from red meat compared to these other sources. So this is something where cardiology and chronic disease merges with environmental impacts when you look at sources of protein. And the last sector, this is looking at the urban sector. And one of my postdocs, Dr. Jason Bargo, came up with this term that we are no longer Homo sapiens, we are Metro sapiens, because as of 2006, more people live in cities than in rural areas, first time in human history. And it's trending upward in the next few decades. I don't know, 70% of people will live in cities by the year 2070 or 2080. I don't know, don't quote me on that, but we are trending to becoming fully urban. And with that, there's a consequence. There are opportunities when people are together and you can have services across more people, but there are some downsides. And when you look at dietary conditions and physical fitness issues, one result, if you look at the trends in obesity, this is from the journal The Lancet. This was a team of scientists looking at obesity around the world. Bottom line, across men and women in every region of the world, obesity rates are going up. And there are multiple factors that all of you know that drive this. And part of it is diet, but I think another part of it is urban design and how we move around and how we, in the United States, we are a completely automobile-dependent society, and many cities are just designed. You can't, if you wanted to walk or bike or have decent mass transit, you don't even have that opportunity. It's an equity issue. You don't have, it's not fair to be forced to only get around in a motor vehicle and therefore miss out on an opportunity for exercise. Let me show you some comparison of cities in the southern province. Title here, Driving Drives Obesity in the US. Look at Washington, D.C. That's on the far left, Washington, the District of Columbia, Washington, D.C. The number one rankings are for cars, ranked number one for leaving the car at home, ranked number one for taking mass transit, ranked number one for walking to commute to work, or number one for biking to commute to work. So Washington, D.C. is ranked number one for, active transportation. They would rank number one for health, but there's a lot of stress in Washington, so they're ranked third for health. Now take a look at, this is the state of Alabama in the southern United States. They are ranked dead last for, driving, not leaving their car for home, not taking mass transit, they're 49th, tied for 49th. Dead last for walking to work, dead last, tied for dead last for biking to work. I think the 51 includes Puerto Rico. So, and they are ranked tied for second to last place as far as obesity rates. They are, the population there, high obesity. Now it's complicated. It's not all transportation. There are cultural issues, there are diet issues, there's access to healthy food issues, a lot of issues. But, this transportation correlation is something it's an interesting correlation. Where I'm from, Wisconsin, we're somewhere in the middle, and we're somewhere in the middle in many ways. Our obesity rates are about in the middle. Anyway, so you can see this look at alternative transportation and its effect on obesity. So for me, when I think about overweight and obesity, it's not a personal issue. It's not, I think it's a design system-wide failure. And I asked you, what's wrong? There's a problem with the next picture, okay, in design. I want you to, it's another tough question. And I think we've designed cities this way. What is wrong with this picture? And we have, in the United States, and in Canada, we drive a lot. We're reliant on the automobile. And so I'll just say for North America, well, I guess that includes Mexico. Well, for the US and Canada, we depend on the automobile a lot, and we are missing an opportunity by not designing cities that are walkable and bikeable that would automatically give physical fitness to a large portion of the population. Look at what the US transportation system in the United States is doing as far as sedentary lifestyles. And a majority of Americans don't even meet the minimum recommended level of physical fitness. And our obesity rates are really high. Our heart disease, 600,000 heart attacks every year. But here's the golden opportunity is that a lot of car trips are really short in less than 3 kilometers or 2 miles, many car trips. So that would be, if you had designed a city well enough, that would be easily bikeable. And in the US, comparing places that have the most active transportation by walking and biking, there's an inverse relationship with diabetes. And there's the same relationship with obesity. So it's not rocket science, it's obvious, population that has the opportunity for more physical fitness for commuting, biking and walking, and mass transit counts too, because on average, if you take mass transit, you get about 20 minutes of good walking. But if you drive door to door, you're missing out on an automatic benefit from physical activity. So I want to show you some work from a physiologist, a famous physiologist. You know, exercise is not just about burning calories. Exercise is not just about burning calories. The benefit of physical activities go way beyond that. This is work by Dr. Pedersen from Denmark. She is at least in 3 or 4 different national academies. She's world famous for exercise physiology. If you Google her, Pedersen, I can't remember her first name, but anyway, she has done extensive studies showing contracting muscles are factories of beneficial anti-cancer and anti-cardiovascular disease chemicals, and also boosted immune system. So, you know, we know exercise is good for us, but it's not just burning fat and burning calories. It is really, look at her papers. And they're over my head, to be honest. I can't remember all the biochemistry from a long time ago, but you know, it's just amazing how beneficial physical fitness is. So, and if you're thinking about population level interventions, and most people can't afford the time and money for gyms and things like that, and they don't belong to universities and have that ability to jump into the university gym, you know, at the population level, if you can design cities that can promote physical fitness, it is a huge prevention intervention. We did a study in our part of the United States, in the upper Midwest. We looked at the 11 largest metropolitan areas in the northern Midwest region across Minnesota, Wisconsin, Ohio, and Illinois. And we asked the question, those short car trips that were 2 miles or 3 kilometers, what if you took those car trips off the road? Just in the metropolitan area, not in the rural area, just the metropolitan area, take the car trips off the road. What would the air pollution benefit be? And then what if only in the summertime, for 4 months of the year, you made half of those car trips into bicycle trips? What would the physical fitness benefit be? If you did that scenario, you would save 1,300 lives a year. And in the US, as far as value of a statistical life, which is a tricky statistic when you do it internationally, but at least in the US, we came up with savings of $8 billion every year from avoided mortality, hospitalization, and absenteeism. So anyway, so bottom line, the headlines that came out of our study: swapping tailpipes for pedals, small changes could pay huge dividends for public health and the economy. And it's up to us in the health sciences to communicate this to decision makers to say, okay, we've seen we all know how important exercise is, and biking and walking. For God's sakes, don't make us have people biking down some highway or some dangerous road. Design cities so it's safe. Design it so there's not a trade-off of exercise benefit versus risk of being hit by a truck, right? We need to demand safe alternative transportation. Another benefit as far as urban design is on mental health. And this is a study out of Milwaukee that showed, looking at by satellite, looking at tree canopy cover and other measures of green space, and it's an index called NDVI, Normalized Vegetative Difference Index. Green space in cities reduces depression, stress, and anxiety at the same level equal to the stress from moving or divorce. So big influence of green space on mental health. A study last year out of the proceedings of the National Academy of Sciences showed that children in Denmark have far fewer psychiatric disorders in their lifetime associated with an inverse relationship with green space where they're growing up. And every one of these graphs is showing a different place, whether or not you grow up in a rural area or a small provincial town or a suburb of the capital or in the capital itself. Your risk of any psychiatric disorder drops as your exposure to green space as a child. So it's really, it's a mental health issue and golden opportunity, multiple benefits from smart urban design or country, just country, thinking about growing up in green space. So I'll just tell you that a lot is happening in the health sciences. There are organizations around the world. In the United States, there's the Medical Society Consortium on Climate and Health. The American Medical Association is part of this. There are medical organizations really recognizing now that climate change absolutely is a health issue. There's internationally the Global Climate and Health Alliance. There's Healthcare Without Harm. There's a green hospital movement. Hospitals emit a lot of greenhouse gas emissions. So there's a movement now to green hospitals. Even in our state, we have a brand new Wisconsin Health Professionals for Climate Action. So I'll end by reminding you of something, one of the most important preventive measures that we've accomplished, which is smoking, anti-smoking. And what we did, one intervention was to raise the price of tobacco. And for every 10% increase in the price of cigarettes, youth smoking dropped by 7%. Well, kind of like smoking, think about industrial pollution and greenhouse gas emissions. Climate change is a public health crisis. And just like tobacco, it's time to put a price on carbon. And there are tricky aspects about that. There are equity aspects about a price on carbon. But British Columbia has figured out a strategic way to put a price on carbon that's equitable. So it's something that we need. And just like the tobacco company, unfortunately, disinformation campaigns are sowing doubt on climate science. So there's a lot of misinformation out there. Anyone who is a student, anyone who looks at social media, in my course, I teach the 11th commandment, thou shalt know thy source. And many times the sources are intentionally deceptive. So thou shalt really know thy source, or thou shalt know the real source of information. But even, with these disinformation campaigns, the message, the clear message about climate action, is that, regardless of one's views on climate science, even if for a climate change denier, I think we can all support in the health framing, clean air from low carbon energy, healthier plant-based diets, safe routes to school, physically fit children and adults from cities designed for people, not just for cars, and reduce stress, depression, and anxiety. So, forget climate change. It's now, it's real, it's serious, but let's forget about climate change. Let's just forget about it. All of these things that happen from getting to a low carbon economy are incredibly beneficial to health, especially looking at chronic disease. So in conclusion, the actions to address the global climate crisis offer enormous health benefits from potential reductions in chronic diseases worldwide. With that, I thank you very much for your attention.